This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us on WAJR. I'm Kyle Wiggs, and with this, as usual, the final Monday of the month. It is Dr. Brian Huggins, health officer for Monongalia County Health Department. And Dr. Huggins, good morning.
Good morning.
Hey, we got you. So the topic today is, where do we go now? Mm-hmm. So where do we go now? It's been up and down for folks in public health.
Yeah, the past few months in particular, there's been a lot of policies, there's been a lot of funding changes, and it's caused us to make some changes at the health department. So we figured it's probably a good idea to come on and explain those changes and then talk about why.
Okay. So where do you want to start? You want to start in the funding issue? Yeah,
let's start kind of why we're seeing the changes that we're seeing. And there's two big reasons. One of them is the Department of Government Efficiency. You know, they went through, they made a bunch of cuts. And with that, we lost grants. So a lot of people don't know that as a health department, where do we get funded? So, I'm jumping a little bit ahead here, but we get some money from the state, directly from the state to administer the basic public health needs. We get some money from the county. We also make some money off of the permits that we have, so health permits, things like that. But a very large percentage of our budget comes from either grants or comes from contracts from organizations like NACHO, which is the National Association of City and County Health Officials. Mm-hmm. Well, when the DOJ went through and they made cuts, there was a big pause, and people probably saw it in the news. A lot of federal grants that get passed through to the state were either paused or stopped. And so some of that resulted in both NACHO canceling some of our grants and whatnot. So that's where we're seeing that. And then the other big thing is there's a big, huge change coming to how the Department of Health and Human Services is going to be structured at the federal level.
Okay.
Yep. And so a lot of big stuff happening. We have seen some direct effect in immunizations. We had one of our big grants that was for vaccines for children. And that's where we're able to actually get vaccines for free to be able to give kids that may not have insurance or, just to make sure they stay vaccinated. That was paused for a little while. It's back, which is great, but there was a couple of months there where that's a big chunk of funding in an immunizations department that just wasn't there. We don't know if it's going to continue in the future. We believe it's going to, but that is one element. Family planning is another one. In our clinic, we offer family planning services, and that really is mostly about getting people contraceptives that work for them, whether it's long-acting or oral, et cetera. And that is funded through Title X through the federal government. That funding has continued, but is slated to be canceled. On the budget that's going through Congress right now, they have line itemed out family planning funding. And so that obviously is something that we're looking at, and I'll talk about that a little bit more. And then a couple other things is funding towards HIV/AIDS, and then funding towards FEMA, towards disaster management is another surprising one. There's just a lot of changes there that, that could affect us.
Mm-hmm. Okay, so another issue locally is the NIOSH situation, and initially that entire building, that entire operation was shut down, but some were called back, correct? Where does that stand right now?
So where that stands is they brought back about 100 to 150 people.
Out of how many?
Out of 500.
Okay.
Yep. And they don't know how long they're brought back for. So it's still this weird limbo area, if you will. The biggest reason they were brought back is the Black Lung program. Mm-hmm. And that's one thing that NIOSH, so black lung, if people aren't aware, is actually back on the rise. Around the 90s, we had identified it, we had put safety precautions in the mines, and they actually had stopped the numbers of black lung that were starting. And then all of a sudden in the early 2000s, we started to not only see black lung come back, but we actually started to see it in 30-year-olds, 40-year-olds that are working in the mines. And what they found out is because it used to be the coal was just there, and since we've drilled all that coal, we're now having to go through some pretty extensive rock to get to the coal. Well, now they're getting silicosis too, which is silica is embedded in a lot of rocks. You'll see it in cement, you see it in marble. And when you go through that, now you have another lung disease called silicosis because it embeds these little glass shards bed in your lungs. And when you combine that with the coal, it actually gets people to have lung disease in their 30s and 40s. And we're seeing a significant increase in those numbers because of just that. And they're trying to put safety, and NIOSH was there to actually make sure it's safer in the mines. But what we're having right now is obviously, and NIOSH in Morgantown, believe it or not, is the only people that were looking at this.
At silicosis.
At mining.
Okay.
And respiratory disease, things like that related to occupational health. So when they eliminated it and then they brought some people back, there's not really a lot of people that are going to be looking at that.
So of all the mines in the country and all of the coal miners in the country, they were looking towards the Morgantown NIOSH office to continue to research and to attempt to prevent black lung and silicosis.
That's correct.
Wow. And they're down to 150 from 500.
Yeah, somewhere between 100 and 150.
Okay. Well, okay. Another thing is let's take one step back. You talked about public health and helping people with basic health care needs. So what are we talking about there?
Yeah. So, and you mean us specifically at Mon? Yeah.
Yes.
Yeah. So the changes that we have had to make, one of the biggest changes is our family planning section. So by West Virginia code, there are 5 basic services. And the 5 basic services are immunizations. It's communicable disease, which is basically disease tracking and making sure you stop disease spread. It's environmental health, it's threat preparedness, and it's health promotions. We can't use state funding or county funding really towards anything that's not one of those basic needs. So everything else is called an enhanced service. We have dental, right? That's an enhanced service. Family planning is an enhanced service. So as we started to lose money that we could put towards basic services, we unfortunately have had to make some difficult decisions at the health department. One of those decisions is our family planning section. We used to offer it 5 days a week, and we've had to go down to 1 day a week. The sad part about family planning in general is it is a money losing venture. It just doesn't, even when you get funding for it, it loses money. And if we do lose the family planning funding completely, I'm working on, so that's part of my future talk. I'm going to try to end the show with some positive here. But I'm hoping that we will be able to continue to offer the services, even if we don't have funding, but it's going to be really tough.
Yeah. Okay. Another aspect that's been affected is FEMA.
Yes.
And we've seen disasters right in our backyard, literally Marion County and Ohio County twice in the last few weeks. And, of course, we're going into hurricane season.
We're going into hurricane season.
Not in West Virginia, but we're going into hurricane season along the coast.
And you never know. Some of them make it inland. Look at
that's true.
Right? Asheville, North Carolina.
Yeah.
They didn't expect to have to deal with that. And look what it did to their area. So you never know with hurricanes. So the big thing with FEMA is there is discussion of whether it's going to be completely shut down, whether it's not. The big change that has happened is normally what happens, you have a big disaster, you write to the president and you said, I'd like to declare a national emergency, national disaster, right? And then as soon as the president says yes, then FEMA kicks in and you get funds from FEMA to help you deal with those disasters. Since some of the changes that have happened in the past few months, there are just less disasters getting declared. So in the southern part of the state, it was requested there be disaster help, and the federal government, I don't believe, had come back and actually said yes. We're still waiting to hear about Ohio County. We're still waiting to hear about Marion County. But unless they say yes to that disaster, the federal funds, they just don't flow. Plus, there's just less FEMA representation. There are just, like, when you talk to the threat prep folks, the regions and what they cover. It's just there's a lot of changes there, which is going to definitely impact how we deal with disasters. And then you've also got the National Oceanic and Atmospheric Administration has also taken a bunch of cuts. And recently I just read in the newspaper that they're going to be shutting down the satellites above the poles that they've used to help to look for hurricanes. And that data, there is a lot of discussion that that's going to severely hamper their ability, especially at night, to be able to watch hurricanes to see what happens to them overnight. So
that affects prep.
That affects a whole lot of disaster preparedness.
People knowing what's coming and how bad it's going to be.
Yeah.
Well, you said there's talk of or the possibility of FEMA dissolving or completely going away. What's the replacement for that?
So that's a good question. A lot of stuff is the big reorganization change is that there are a lot of agencies like SAMHSA, which is Substance Abuse and Mental Health Administration. You've got HRSA, you've got the Toxic Substance Disease Registry, and NIOSH are all supposed to now flow into what's called the Administration for a Healthy America. So all of these agencies that did exist, and one of those was also the ASPR, which is the Administration for Preparedness and Response. Those are that is actually going to go into the CDC. So FEMA, ASPR, the things that dealt with disaster management are supposed to now roll back under the CDC. And a lot of these other organizations that did at one point fall under the CDC, they were sub-organizations, are now going to fall under the Administration for a Healthy America. We don't know yet. So what we're being told is that all the services are going to continue. They're going to be funded less, but they're going to change hands. We don't know. And that's for us. Where do we go now? That's kind of the topic. Is it's even a question for us. We're not sure. We're waiting to see. A lot of it revolves around the budget that is currently being sent through Congress because these changes are a big part of that budget. So it'll take that budget getting approved. It'll take them moving the agencies. But in the process, anytime you make major shifts, right, you can expect there's going to be some hiccups. There's going to be some. So at the local level, right now, the state is heavily dependent on the federal, and then we're heavily dependent on both the state and the federal. We're waiting to see.
Yeah, there's uncertainty.
Yeah.
Well, let me ask you this. I mean, what's the status of DOGE? Elon Musk is no longer in the picture. He was the leader of that. Are the cuts that were made under his purview, do they still stand? Because it seems like the thing's dissolving.
That's a great question. As far as we can tell, whatever happened is staying. But there is a lot of looking back, so a lot of cuts were made quickly. And I will say, same thing with NIOSH.
Right,
is they're making broad strokes, and then they're coming back, and they're looking at where the gaps are, and they are adding some things back in. But it's still just a lot of uncertainty, right? I mean, if you're a federal worker and you had your job eliminated, what do you want to do with that? And so, it's been tough. And in public health in general, we have a lot of students at the School of Public Health that are curious, what does this career look like for me? And I tell everybody that, even though the job market might be a little tough right now, I firmly believe there will always be a swinging back to public health, right? Like public health is prevention. Public health is keeping people safe. And I'll talk about that in our last few minutes. I'll talk about some of the things that I'm getting started at the health department that really is going to hopefully make a difference. But there will be a shift back to where, and knock on something, it's not another pandemic, right? I don't want that to occur. But there should be a swinging back there always is. There's ebbs and flows.
Okay. We'll talk about the future here in a moment, but just take a moment and talk about what's the status right now of the Monongalia County Health Department. Have you lost employees? You talked about the funding and the financing, which is all up in the air. But in terms of personnel and in terms of the day-to-day operation of your office, how is it?
So right now, all of our services are still being offered at some level. We have had to make a few changes with personnel, specifically in our family planning section, and in with our infectious disease and communicable disease branch. We've had to reduce some staffing there. Unfortunately, we lost all of our funding that went towards the healthcare associated infections. We were actually standing up kind of a larger program to try to really like focus on that. We're still responding to that, but we've lost some of that capability to be able to focus in that area. Other than that, right now, we're just being very cautious. Like we made a budget for the following year that we are still hiring the positions that we need to hire. We're not on a hiring freeze. We're not doing anything like that. We will continue to offer all of the basic public health services and more. So right now, we're still offering everything that we have in the past. We're just being very careful about the future.
When you hire, I mean, WVU's right here. Is that where a large part of your hirings come from? Are they graduates of WVU?
They've been a great pipeline for us. Sometimes that's where we get people from, sometimes not. But I've been bringing in a bunch of master's students and bachelor students just to intern at the health department, and we've definitely gotten a couple of hires from that group.
Okay, very good. All right, you wanted to finish on a positive, and so let's talk about the future, some of the things that you're working on.
Yeah, the big thing that we're doing is obviously if we're losing grants and we're losing things, we're looking at other revenue streams. We're looking at other ways that we're going to be able to become a little more financially independent. But one of the big things that we're focusing on is really at the health promotion side. Health promotions is a basic public health service, and it is funded by the state government. And we're kind of stepping out. In the past, it's kind of been what's the needs of the area and kind of doing one outreach event. We're kind of standing up a unit that's going to really, really provide some really cool possibilities for the future. We're looking at making like a little wellness passport where people are going to be able to go around to get stamps and potentially maybe win a prize if you actually go to enough parks in the area. if you do a 5K, so hopefully we'll be lucky and we'll get some sponsors to help us with that. But I refer to it a little bit like an ale trail. If anybody's ever seen an ale trail where you go in the bars and you get a stamp, well, this is about being healthy. We're going to start doing some classes. We're going to try to develop some classes around even personal resilience, like doomsday prepper classes, right? Like, wouldn't it be fun to come learn what you can eat in the woods, what you can't eat in the woods? And some people even say, I just want to learn to sew because, if a real bad, zombie apocalypse or something, right? You might need to learn to sew. And then we're also trying to offer more services for people. We're offering like immigration services. We're offering travel medicine. Travel medicine's a big one. If you're getting ready to travel, come talk to us because we'll make sure that you know everything you need to know about it. Like I just recently saw somebody climbing Kilimanjaro. And when you climb Kilimanjaro, altitude, it'll kill you. So it's just thinking through those kinds of things. And then we want to also be able to offer things like radon testing to the community. So we are going to continue to, on some level, grow and adapt to the changing environment. But we will always be there to still offer those services. We're still completely open. We're still open 5 days a week. We're still going to have everything that we've been doing.
That's the baseline.
Yeah.
Somebody locally climb Kilimanjaro?
Yeah. I get people, Kilimanjaro's, well, quote unquote, one of the easier of the tallest mountains in the world. So, and by saying that, it means you don't need technical gear to climb it, but it's still a tallest mountain in the world, right?
So. Yeah, that's not simple. And you talk about the altitude sickness.
Oh, yeah. Yeah. And it's, there's medication you can take to help with it. But the biggest thing, if anybody actually is thinking about climbing a mountain out there, it's all about slow. And the cure for altitude sickness is always descent. Yeah, there's a story about a guy that a bunch of natives that had gone up a high mountain and they thought their friend was dead. They put him in a bag, were bringing him down, and then all of a sudden he comes back. He wakes up, and they thought he was a ghost, and they ran down to the local pub, and then he shows up. Why'd you leave me on the mountain?
Oh, that's funny, but it's not. It is kind of funny because everything apparently turned out okay.
Everything was okay.
Everything was okay. All right, very good. We appreciate your time. Thanks for coming in. Good information and good luck.
Thank you.
You guys have dealt with a lot. We understand that. And, unintended consequences of all of this, we saw first and foremost NIOSH. And, of course, your department, not to diminish what you're going through, but I think NIOSH has been the biggest example of that.
And if anybody really is concerned about it, of course, you can reach out to your lawmakers, your politicians, and let your voice be heard.
Very good. All right, Dr. Brian Huggins, Health Officer for Monongalia County Health Department. This has been Mon Health Talk for this Monday, and a very good and detailed update as to the condition of public health through this day of change. That is Mon Health Talk for this Monday. Thanks for listening on WAJR.